A 66 years old man has been suffering from weight loss and developed severe abdominal pain. He is admitted to hospital and undergoes laparotomy. At operation, there is entire small bowel is infracted and only the left colon is viable. So what is the most likely explanation? So there is a long area or big area of the bowel is infracted. Small bowel, they are involved the duodenum, jejunum, ileum, and also only the left colon viable. That means the right colon also involved. So what is the cause? So first of all, let's see, it is the weight loss. So when weight loss develop? Weight loss, is it develop within few days? No, it requires a longer time. So it is a chronic condition. The second option, they develop severe abdominal pain. Severe abdominal pain, that means it is an acute condition. So it is an acute condition. So in this question, two portion present. One is the chronic position and another one is the acute position or acute condition. Weight loss, it requires longer time to develop. On the other hand, there is severe abdominal pain. Severe abdominal pain always acute. So it is acute and chronic condition. So what may be the options? The options are the mesenteric venous thrombosis, acute on chronic mesenteric ischemia, acute embolus to inferior mesenteric artery, acute embolus affecting the celiac axis, and arcuate ligament compression syndrome. What may be the option? Now see, in this question, the whole of the small intestine, that means this part which is the duodenum is infracted. Then whole of the small intestine which is the jejunum and ileum, they are also impacted, and the part of this colon, that means right colon and transverse colon, they are also infected. So first of all, let's see the blood supply of this area. They are supplied by the superior mesenteric artery. This one is the superior mesenteric artery. Here we can see this is the superior mesenteric artery. The superior mesenteric artery arising from the aorta. Actually, it is the anterior branch of the aorta, and then supplies the duodenum, jejunum, ileum, cecum, right colon, and 2/3 of the transverse colon. So when this vessel will involve in this condition may develop, and the rest of the part, they are supplied by this artery which is the inferior mesenteric artery, and it is also the anterior branch, but it originated from the lower part of the abdominal aorta. Now see the acute on chronic mesenteric ischemia. What occurs in acute and on chronic mesenteric ischemia? Usually it is a longer history, and postprandial abdominal discomfort and weight loss are dominant. So here the key feature is the weight loss, which is very, very important. A patient who is suffering from severe acute abdominal pain and the weight loss history, in this condition, the diagnosis will be acute on chronic mesenteric ischemia. And patient will usually present with acute on chronic event. It is another point. That means acute on chronic event. There is a chronic history, but they are also develop acute condition. Will tend not to present until mesenteric flow is reduced greater than 80%. So mesenteric vessel or mesenteric artery which is gradually narrowing, but the symptom present only when there is the blockage is more than 80%. In the chronic setting, the symptom will often be those of the ischemic colitis, mucosa in the most sensitive area of this insult. So in the chronic condition, the symptoms are often due to ischemic colitis, and the main symptom is the diarrhea and severe abdominal pain. That means acute on chronic event. How we can diagnose the condition? There are different options, but the most important diagnostic option is the CT angiography. CT angiography, it gives details about the mesenteric ischemia, but other options such as the WBC count or white blood cell count, serum lactate, CRP amylase, they can be done. And superior mesenteric artery duplex study also useful to evaluation of the proximal superior mesenteric artery disease in patient with chronic mesenteric ischemia, and MRI is limited use. So CT angiography and superior mesenteric artery duplex study, this is very, very helpful, but MRI is limited use or no use due to the peristaltic movement their artifact develops, and the MRI usually cannot give the better image for us. This man is likely to have underlying chronic mesenteric vascular disease, and only 15% of the emboli will include the superior mesenteric artery originated from the inter-ischial wall infection. So, only 15%. In case of embolic obstruction occurs only 15%. Rest of the disease are not the embolic event. And history of the weight loss are favors in acute and chronic condition, because the weight loss, it requires a longer time to development of the weight loss. So when there is a weight loss, there we should suspect it is a chronic condition. So again, see what the findings was the weight loss and development of the severe abdominal pain. Severe abdominal pain, it is acute condition, but we have to keep in mind that weight loss, it is chronic condition. So we have to find acute and chronic condition, but only acute conditions such as these options, they are not true. Also the arcuate ligament compression syndrome, it is, the scenario is different, because in this condition there are usually vomiting also present. And mesenteric venous thrombosis, the symptom of mesenteric venous thrombosis different from this. So it will be acute and chronic condition. That means it is the acute on chronic mesenteric ischemia. For this condition, that means the acute and chronic mesenteric ischemia, this patient develop this such type of condition, because when there is the reduced flow to mesenteric artery, that is when there is reduced flow to mesenteric artery, then the metabolism of the small intestine will be reduced. So there is less absorption. As there is less absorption, so body gets less amount of the oxygen, less amount of the glucose, carbohydrate, glucose, protein, fat, and other component. For this condition, patient usually lost weight gradually.